Development Officer here at Meg Academy, and I have some very special guests with us today. We have, of course, Brian Gallagher, who's the founder of Meg, and we have Kevin Posey, who is one of our senior coaches, and he's also a managing partner of a clinic in New Hampshire. And then we also have Angie Mcgilvery, who is with us today and from Fort Myers. She is the owner of Apex Physical Therapy. So thank you all for joining us today. We're going to have, I think, a very good discussion on being a leader through this pandemic. We're definitely, going through some unprecedented times, and they're presenting some very unprecedented challenges. So today we want to talk about how to be an effective leader through these challenges, what actions you can take right now, and then also we're going to provide some clarification on the CARES Act, because we are getting a ton of questions within the last week, especially on the PPP in particular. So Brian's going to break some of those questions down and hopefully give us some answers to some of the questions that you guys have. So what I want you to walk away from today is to have some successful actions to either maintain staff morale or improve staff morale. Also to kind of give you some preparations that you can do right now to plan for this post-pandemic success. And then obviously give you some options for funding. I know some of you have been funded by PPP, some of you have not. We're going to talk about some of the options of where you're at right now. We are going to, as a giveaway today, give you a free inside exclusive look into Meg Academy. We've gotten a lot of questions about what Meg Academy is in the last week as well. So we're going to give you a 3-video series, and Matthew is going to put that link up. And in that link, you will be able to watch all of those videos. And at the end, you could even potentially sign up for a more customized practice assessment of your practice. So please take advantage of that. Again, the link should be up right now. I want to jump right into this topic because it's a topic that I think we're all having to navigate in different levels and extremes. Some of us have been more severely impacted than others by the coronavirus pandemic. But we are all kind of having a similar challenges to have to navigate through. So I want to talk first about, maybe Angie, you can weigh in. How are you navigating through this crisis and trying to maintain staff morale during this time?
Thank you, Nicole. From day one, the first time I brought my staff together, the point that I brought across was that we were going to perform and not panic. And ever since that day one that we got together and said that, that has been our theme throughout. That, again, we're performing and we're not panicking, we're moving forwards together. And I think with building that morale has come communication, transparency, and keeping them productive and giving them purpose as much as possible. So that's been kind of the 3 pillars that I've been operating on.
Very good. And Kevin, do you have any words of advice on that particular topic?
No, I agree with Angie. I think, you knew it was coming and you could see it, where it was going to be going. And the important thing is to have a plan and making sure that you communicate that plan the best way that you can. So people aren't surprised by anything. They want to know they're going to be taken care of. We also tried to just make sure we were solution-oriented, not problem-oriented, and focused on patient care as our #1 priority. How do we continue to take care of the patients? How do we find a way to take care of them, even if we can't see them in person? And focusing on those sorts of solutions and making it more about taking care of our people more than anything.
Yeah. And have you had staff members who, kind of get discouraged, and how do you handle that? What are you doing to improve that morale? Because it's about the patients, but it's also about your people.
Yeah, and it's being honest with them. I understand it's scary. It's scary for all of us, and promising something that I can't deliver on. I'm trying to be sure that they understand that we're doing our best to take care of them, but being honest with them on what the plan is, and doing our homework and understanding what programs are out there to help them. Everybody's worried about paying their bills and living their life, and if they know that there is a plan in place where we can get them to the point where they can cover their basic needs while we get through this process, then we're going to help them through that as best we can.
Yeah. Very good. And Brian, I want you to weigh in on this because I know, and I'm going to tell a little bit about our story. I feel like, you know, we talk a lot about and train a lot about transparency breeds trust, and communication is so important. And I'm gonna be a testament to this guy and his wife Lisa, both as leaders. They live and die by that. And I'll be honest, we have gotten more communication from you in the last month, and you know, we communicate on a you know, continual basis as being an executive level manager type. But for all the staff, the feedback that you're getting on a regular basis is how much communication has been so helpful for them to get through this, because it's scary. I mean, a lot of this unknown is very scary. And the fact that you have been giving us not only emails, but video emails and speaking directly to us and getting us all together in Zoom video chats so that we can dialogue about things, and being very, you know, giving. He's been a very giving person too through all of this. He's giving us all masks and to help keep our families protected, and just being vulnerable when, you know, I know the last meeting, you know, we finally got funded by the PPP, and with tears in his eyes, you know, he proudly said that we're going to go back to full time, but he's been very giving through this time. So I know we talk a lot about that to train our people, but he really lives by that as well. So I know that's been helpful for me as an employee, to get motivated, to want to work really hard, to be able to help more people, you know, just like he's doing for us. So
I appreciate you sharing that, and that's very kind of you. I really think, you know, it's true testament just to see the panelists that are on here. You know, both of these two are just wonderful people. They're people that I met in the journey of trying to help their practices grow and thrive and succeed at the times that they brought me in, which for both of them was well over 4 years ago. And now here they are, you know. I think to answer that question, I think, you know, you just have to do human well, you know. I think at times of crisis, it's time to really step up the game of just being a good human being. And I think it takes a minute to step back and just think about the basic principles of human nature. And I think with that a lot. Like, I know in the absence of information, it is the common tendency for people to think the worst. Yep. And I think if you're going to really be a leader for your practice, and you're going to be a good executive and a good practice owner, you have to fill that void. You have to fill that vacuum, because if you leave it up to the news networks, it's just going to create such a degree of uncertainty and such a degree of question and doubt that people that you normally saw under normal circumstances that could just take on the world will immediately start to crumble right before your eyes. And it's because of these external influences. So I think inside of what we train I mean, these two are just shining examples. You as well, Nicole. I mean, I met you, you know, I had to use a passport to get to you up in Wisconsin or wherever you were, but I got there. I mean, I made it through. And it's about filling that vacuum. It's about being a better communicator. It's about understanding that when you feel your best on a weekend day, and I can talk for Angie because I swear to God, she gets up at like 4:30 in the morning, is like, where's the closest CrossFit? I'm on vacation. I have to get into a CrossFit. It's like 4:30 in the morning, Angie. You do not have to hit. Yes, I got to be done by 7. And why is that? Because Angie's going to be up and out of bed in CrossFit and have a workout. She's got 2 more workout sessions to do later in the day. And she's going to go to bed at like 9, 10 o'clock at night that night. And she's going to say to herself, what a productive day. I am so happy. Why is that? Because when we're most productive, we have our happiest moments in life. It's not like when you wake up and you have your bunny slippers on in Wisconsin and you're like, I just need to go get a loaf of cheese and come home, and that's all I got on my schedule for the day. If that's all you're going to do for the day, you're going to be like, well, I got something done, but I didn't really. This is the moment of like really challenging ourselves to increase the morale with our staff. So it has to do with do human well, fill the vacuum with positive, good, clear, concise communication. Do it in a confident way. Do it with certainty. read what you need to read so that you're actually giving them something to hang on to that's tangible. And whatever you do, increase the production, increase the busyness, because that is going to be the Angie of the world, where I've done 3 CrossFit sessions in a day because it's just been an average good day. That's what we have to do. And we have to carry that through the whole distance. I mean, I'm talking from now to August. You just can't take your foot off the gas. That's my short answer.
And to do it with enthusiasm. Like, I think you guys think he's just like this on here. It's not true.
Right.
Like, it's Kevin, you got my back on this. It is all the time. He does everything with enthusiasm. And I know, Angie, you're that way too. And Kevin, you as well. It's like, if you're going to do it with enthusiasm, and it's contagious. You know, there's others that want to be on board with it just because, you know,
we believe in it so much, right? You believe in it so much, you just want to run with it. I mean, that's
right.
That's the point.
That's right. Exactly.
Okay. I think that, I'm sorry, Nicole.
No, go ahead.
If I can just add on to what, and I don't know if you're going to go into this as far as like what other owners can do from the standpoint, as Brian was saying, is, you know, our morale is the highest when we are producing and we are successful. There are some specific things that we have done, and I don't know if you want
Please share.
me to go
that
into that at
I
this
would
point,
love that. Yes, I think
Yes.
our listeners would love to hear that.
So, you know, from the very beginning, we said, all right, we have less patients, obviously, in the clinic. Number one, we need to service our patients that we can still service now. How do we do that the best? And then how do we prepare for servicing our population even better when this epidemic is over and we are able to see more and more either in the clinic or virtually? And some examples of that have been, I've had my therapist actually create a YouTube channel, and they have videoed, we probably have almost 300 exercises in there now. And so when our patients need home exercise programs, when we come back, and we're using it now as well, not only do we need to do we don't need to do like the 1982 like piece of paper with like the miserable pictures that we all use.
That's awesome.
We actually can give them a link and everything to our YouTube and say, here, go into these, and they can actually watch one of our therapists doing them. So we've created a huge library to do that. That's just one project that I had my therapists doing while they couldn't necessarily be treating as many patients, you know, as they typically would be. But to them, they were still producing, and they had a job to do that day. They had fun doing it. They enjoyed it. They had a ton of bloopers from doing it, and they had a good time, and that kept morale going, you know, in the clinic as well. So that was just
a great idea. I love that. I love that. Yeah. And if there's any more of those examples, because I think that's a great way to prep yourself so that you're better off for when the dust does settle and you are ready to go back full steam ahead. You know, if there's anything that we can make more efficient so that you're, you know, sending them a YouTube channel versus having to, you know, go print out some square box exercises. I mean, that's a big value right there.
Nicole, you should share about our Fun Fridays.
Yes, so Rachel is putting together our Fun Friday. She's doing some fun little video excerpts with like a theme each week. So all of our staff members are recording themselves, or this week it's going to be a Throwback Friday, and we're doing some throwback pictures from, you know, whenever you want. It can be baby pictures, whenever, you know. So that's kind of a fun thing that we've added in, and every Friday we look forward to that. So yeah, it's a good use of time. But same thing in Meg, we have a lot of our billers, because production has slowed down a bit, working on some of the things that, you know, you tend to push aside, that you push off to later because things get so busy. You know, so we have them working on different research projects that we have going on right now as well. So I think that's great if we can keep that production going. Okay. We have some specific questions that we've gotten from some clients, and I want to go through those. Brian, if you can answer, we have one client who asked about COVID-19 policies. Is it necessary to create specific COVID-19 policies, or should you just create policies that are more generic and, you know, deal with times of emergency or low census, or, you know, disaster plans, things like that, that kind of fall into different categories like that, versus COVID-19 specific?
I think a little bit of both, right? I think you absolutely have to have COVID-19 policies. I mean, that is what's recommended by the CDC and the World Health Organization as well. We are in the midst of a pandemic. I think it would be prudent to actually have that. I know for those of you who have been listening, we created a tip sheet, and then we created it into a blog, and we put that on our website, and it's an environmental set of recommendations. What I did was I was up till like 2 a.m. a week or so ago, several days actually, and I researched CDC, World Health Organization, OSHA, APTA, and then I consulted with a national HIPAA compliance consultant that we use, Daniel Hirsch. And if you guys need to get connected with him, I can easily connect you with him. He's fantastic. He's very affordable. He actually handles this kind of stuff on a large scale. That's what he does. He's a physical therapist too, so it's just great, you know. And I compiled all of this data, and I created it into a series. And so the first one I just wanted to put out there to everybody. So it's on our website. If you go to megbusiness.com and go to our resource tab, we'll have the link here on our telecast here. And so you can go and get that in the form of a blog, right? So you definitely do have to follow those guidelines, because you have to create a safe environment for your staff, your patients, yourself, obviously. And you have to demonstrate that you've done your homework. And there has been no organization within the profession of physical therapy that has said, hey, this is the new Practice Act guidelines, and you would be found negligent if you didn't follow this. But we need to step out and just kind of create it. So that's what we did. We didn't wait for somebody else to do it. We just did it, and it's out there for everybody. So I welcome all of you listening to take full advantage of that.
Yep, exactly. Okay. And just kind of along those kind of same lines, we have a question that says, can my staff refuse to work? What should I do if they refuse to come in out of fear of getting sick? So it kind of goes along, I think, with those similar policies.
Well, I'm going to say one thing, and then I want to hear you two guys weigh in on this, because I sat in on an 1.5-hour webinar by a law office about this. And, you know, it's kind of the Wild West right now. It's really kind of the Wild West, because technically speaking, no, they're not allowed to sit at home, and they're not allowed to say, I don't want to come to work because I'm afraid. Well, that's on you, right? And I'm not saying it unempathetically, and I'm not saying it in any way, but there is no trace of COVID-19 in our clinic. We are taking all policies and precautions. We have created a safe work environment, but because you don't want to come, you are now eligible to use your PTO and to stay at home without pay. But you did not get furloughed. You did not get laid off. So you're technically, by government standards, you're not eligible for unemployment. But what I have seen across America, and I've been getting calls every single day this week, is that people are saying, for any reason somebody chooses now just to say, I have a fear or a concern not to come to work, they are filing for unemployment, and people are literally getting it. And even though you refuse it and you say, this person was not laid off, they don't qualify for unemployment, I have a job for them, I have a position, I am going to pay them. The fact of the matter is, the government has set it up that they are willing to pay people more money than they're going to make on the position that they left for staying at home. And I know Angie was recently on TV on this particular topic, and I'll let her just share with you her thoughts on that idea, because this gets me really riled up. Well, now we're competing with the federal government.
That's right. We can get into that. Go ahead, Angie. Go ahead and tell the people.
First off, I concur with Brian, as well as I've also had legal consult as well. And basically, if it is just in fact fear, then the same way that you would handle pandemic, non-pandemic, an employee coming into your office and saying, I just don't want to come to work, whatever that policy and procedure is, that's the policy and procedure you follow.
Right.
That's straightforward. If it is non-COVID related, you know, they're not seeking testing, they don't have symptoms, they're not taking care of a family member. You know, if it's outside of the FMLA, then it's how you would normally handle that. So we haven't had to deal with that necessarily in our office, but it was something that we did look into just in case that situation did come up. Because in talking to other owners across the country, I had heard that was an issue. Yeah, we can get into what Brian kind of led into there a little bit if we want to. So go ahead, Nicole.
Yeah, let's get into that, but we do have a question from Gregory. Gregory, can we unmic Gregory?
No,
Just
I can
'cause he
read his
thinks-
question. It
Yeah.
says, do you not want PTs to get paid if they don't come into work for risk of infection? I want everyone to get paid what they're due, right? What the responsibility is to that employee. I don't want to do something special for one person that's at an economic disadvantage for another, because now I'm going to be brought up on discrimination, right? If, like Angie said, if your policies and procedures stipulate what the off work policy is, you must adhere to that. And like I said, it's not being unempathetic. That's not it. But if one person chooses to stay home for whatever fear or consideration that they have, but yet you are abiding by the policies you have and you've created the safe work environment, that is their choice. And by all means, they're welcome to take that. But that does not mean that I have to pay them for that. They can take their PTO, they can use their vacation time, they can use their FMLA, whatever is available to them. But that doesn't mean I have to extend salary and pay to them while everybody else is coming to work and participating in our work environment. That's all I'm saying. And that's exactly what the attorney webinar said clearly. Do not start bending these rules because they're going to come back and be used against you. And I'm just trying to look out for your best interest. Stick to your policies and procedures because they're there for a reason.
Okay, so I think he's asking if you wouldn't give them the PPP.
You cannot pay people PPP funds for sitting at home. They're not at work. That is a violation. That is not covered under the PPP. That's not what that says.
But I guess the only exception would be is if they're doing telehealth from home.
Well, they're working.
So that would be the exception, is if you're
That's
home.
The exception. They're working.
Doing telehealth.
The location doesn't matter, but they have to be working, right? They can't be at home not working. Claiming unemployment is what we're really seeing. I had an owner call me 2 days ago from one of the southern states here, and he says, literally, I had two techs, both making $15 an hour. One decided to stay home, did not want to come in for fear of COVID-19. The other one's like, I have no fear. We have no reason to fear that. There is no case here. There's no evidence of any of that. And the person chose to stay home and file for unemployment. Well, they're technically under unemployment law, has nothing to do with my opinion or anybody else's opinion or this owner's opinion either. Unemployment law says, well, you haven't been unemployed. You haven't been let go. You haven't been furloughed, or you have a job. The person actually has a job for them to come. You just chose not to come into the job. So he appealed it. He's like, I didn't let them go. I have a position for them. The state is still giving them unemployment. And I have been hearing from owners all across the country that that's what's happening. That is what I mean by now you're competing with the federal government paying people their full pay plus $600 to stay at home when you actually have a position for them.
Yeah, and let's get into that a little bit, Angie, because I know you wanted to talk a bit on that topic. Can we move on to that particular topic?
Yeah, sure. So basically here, we have, because I believe it's the right thing, we have kept 82% of our staff on their full salary, on their full, their full benefits. We've had to do a small amount of furlough, but again, 82% functioning, I think is pretty darn good given the situation that we're in. Mm-hmm. Obviously, that expectation on the other side of that, at the end of March, when the CARES Act was released, was that we, as small business owners, were going to get some type of a stimulus or assistance with that. So sure. I'm doing the right thing, and I'm footing the bill, and I'm paying my people, and I have no problem doing that because I want to take care of them. They take care of me. They take care of Apex. I want to take care of them. And so, that's what I've chose to do. And I've been very transparent with my staff the whole time about that's the process. And every week, we update, and this is where we're at, and this is what's happening. And then it's maddening when you see that small businesses like myself and many others out there have received no PP loans or PPP funds, right? Mm-hmm. It's given to huge, mega publicly traded companies. The right. Small business person is left out, and people are being incentivized to not come to work.
Sure.
So it's insane. So, you know, at the end of March, I was very optimistic from the standpoint of we have assistance coming from this CARES Act, and there's going to be a very supportive foundation here. Obviously, that has not been the case.
Sure.
I mean, data says it not been the case. Again, I'm still going to keep performing and still keep moving forwards, but
Right.
it is definitely a maddening. Yeah.
Absolutely. And you're not alone. I know we've gotten other owners who have not been funded as well. Brian, what advice can you give to people, or Kevin, you know, what advice can you give to people who are in that position?
Go ahead, Kevin.
I'm not in that position, so I don't know if I'm the best to discuss that. We weren't really qualified for applying for the PPP, so it really doesn't apply to us. I'm grateful, though, that I didn't have to get to the situation. We have not had enough business in the clinic necessarily to have more than just a small crew on staff at any given point in time. So we've had plenty of coverage in there. We have had to use some furloughs with people, and but we are having people still take care of all their clients with telehealth. So thankfully, I haven't had to have to confront that in my situation.
Very good.
Yeah, that's good. That's really good. You know, I see a lot of the questions coming in from Gregory, and I definitely want to, you know, address his questions. If in fact you're in a restricted area, such as New York City, New Jersey, Detroit, you must abide by your stay-at-home orders, of course. If you're in some of those really, you know, lockdown areas where you have some threatening risks, you have to abide by what your governor's rules and regulations are, for sure. And I'm not asking anybody to go against that. But for me, I'm a national known, you know, person here, and I'm dealing with owners all across the country. I literally have clinics in Texas that are like, yeah, I'm down 20, 30%. You know, the one I was referring to is down 40, 50%. No known cases in their area, no risk of spreading the virus, to be more specific to Gregory's questions. So that is not the question. That's not the question you asked, Nicole. And that's why the answer I gave is that. If in fact there is a known case, and if in fact there is an infection, you need to act accordingly in accordance with the CDC. Right. But we are an essential operation. We are an essential provider. So you should operate as such. You shouldn't just, you know, forgo that. You have people that are actually in need of our care and who will get worse without our care. So as long as you are abiding by these guidelines, the practice guidelines, and you're practicing appropriately, your employees should feel comfortable coming to work. I sat in on a legal webinar, and I'm just going to read this one question. We can move on off of this topic. Let's see. I have several of these questions. I guess the best one here is, what should I do if I have an asymptomatic employee refusing to come to work due to fears of COVID-19? That's kind of like the question you asked, right? So there's no evidence of COVID-19. There's no evidence with them, you, or the workplace. The answer from the attorney, this isn't Brian Gallagher, this is the attorney. None of the paid sick laws cover these individuals being absent. Of course, unless you have a written medical advice, a written letter of medical advice from a doctor for them not to come into work. Of course you want to abide by that, right? Not to come into work. I lost my spot there. So be flexible. And this is what I said in my answer too. Be flexible. If you know you have existing policies that can cover these individuals, such as, you know, PTO, time off, or you can let them go with unpaid time off, and you have a policy for that, by all means do that. I am not suggesting anybody be harsh with anybody. So Gregory, I'm not sure if you misinterpreted what I was actually saying, but what I am saying is, if you have that healthy environment, that safe place, because this is a big country, Idaho is not the same as Brooklyn, you've got to be fair to the rest of your workers who are coming to work. And that's really the short of it.
Yeah. We have a question from Melanie. What if you only have enough work for 2 therapists and you have 3? The third wants to stay home and help elderly patients. I am waiting for my PPP funding. I have loan approval, been waiting 1 week so far, not sure what to do.
Oh, so they want to know what to do if they haven't been getting their PPP funding?
Right.
When
So
do
and
they?
she only has enough work for 2 therapists, but they have 3. The third wants to stay home and to help elderly patients.
Okay.
They're waiting for PPP funding, has loan approval. They've been waiting a week so far, not quite sure what to do.
Okay. So if they've gotten through the process of doing the DocuSign documents and they have an SBA 147 4.1 form already completed, then they are in the process for funding. Once they're in the approval for funding, they must get funded according to the CARES Act. They must get funded within 10 days. So chances are funding's coming. For the employee who wants to stay home and care for the elderly family member, absolutely let them do that, right? They don't need to come back to work if that's in fact the case. That would fall under the FFCRA.
Yeah.
Right? So you could definitely go that route. The other two, you've got 2 ways to play the PPP once you get your funding. You could either bring a whole bunch of people back, get them working, get them employed, get them on the books for the 8 weeks. Absolutely can do that. You're going to inflate your payroll, but you better have a discussion with them that at the end of the 8 weeks, if in fact you don't have the census up to carry them, people will be put back to a reduced hours, reduced schedule, or possibly even laid off or furloughed again, because you're not going to have the revenue after the funds run out to support them on the long haul. So just be transparent, be open. It's the most important thing. Be compassionate, open, and transparent with all of your employees as to what your intentions are and what you can or can't do, because you're trying to survive this crisis. But there is another crisis looming at the end of these 8 weeks in my book. Or strategy 2. Bring the people back that you know you need, ramp up accordingly through the 8 weeks. You may not have as much forgiven. It may be more of a loan than it is a forgiveness, but you're going to have the appropriate staffing to meet the demands, and you're going to have the appropriate revenue stream to support you through the rest of the summer.
Okay. And Susan is wondering does the 8 weeks start the day the loan was signed?
It's actually 56 days from the day the funds are dispersed into your account. 56 days is 8 weeks, and it goes from the day the funds are dispersed in your account.
Okay. And can you further clarify on the rules of the PPP? Because I feel like we get a lot of questions about the details of what can be allocated to what in terms of payroll versus other expenses.
So do you guys want to jump in on that, or do you want me to do it?
Go for it, Brian, because I don't have one.
Oh boy. Well, the PPP had 3 revisions, right? Or 2 revisions. There's been 3 from, version 1, version 2, version 3, right? When I sat on the SBA webinar last week here in Florida, they basically said, if you hadn't been funded, go to another bank, right? Pursue another bank, because it seems that the banks that are actually assigning a banking lender, a lending agent to process your claims and kind of hand carry you through, those are the ones that are getting funded first. The big banks that are just throwing you in a portal and just letting it rip, they're taking longer to get processed and funded. That seems to be the general rule, if you will, if you look at Bank of America, Wells Fargo, as opposed to credit unions and stuff like that. But more specifically, you're saying your question was what about
what are the specifics of the PPP? Like what can you allocate, what needs to be allocated towards, payroll?
Yes.
And how do you define like what that other 25% can be?
Yeah.
They say utilities. Does that include EMR? Does that,
Yeah.
like how far can you stretch that in terms of?
Yeah. And so you're using these funds and you're seeking the opportunity to have it forgiven, right? So let's assume you got funded $150,000. If you got funded $150,000 and you spent $100,000 of it on rent, mortgage, health insurance coverage, utilities, so to speak, and a portion of it on the payroll costs, the overall payroll, wages, salaries, commissions, things like that. In order to get it forgiven, of the $100,000 that you spent on these eligible expenditures within the PPP, you can't spend more than 25% of it on non-payroll costs items. Okay, so this is an important part. People are getting a little confused saying, well, I got $150,000. I can spend 75,000, 75% here, 25% there. It's not on the total funds dispersed. It's on the total amount you're asking for forgiveness. And this was clarified in a webinar by SBA today. So I was really glad to sit in on that and be able to share that with everybody today, that it's the amount of money you're asking for forgiveness. 75% should be on payroll costs, 25% on the other eligible costs that are listed in the CARES Act that I just mentioned.
Okay, and then we have a question. Can you explain the full-time equivalent headcount on June 30th? Like what the specifications are for that?
The full-time equivalent headcount is going to be calculated based on the total hours worked per pay period through the 8-week window. So if you have 4 pay periods in the 8-week window, they're going to take the total number of hours per each pay period divided by 40 and get an FTE. That FTE has to match or exceed what the baseline FTE was that you applied for when you went for the PPP. You had 3 options on the application. You could go 2019, you could go trailing 12 months, and so on. So whichever one you picked, whatever that is, you want to be above that. Now, unfortunately, I'm hearing that there's some owners out there that are hiring 2 of their 7 therapists or 2 of their 6 therapists back, and then they're hiring 10 techs. And they're running up the FTEs so that they can meet that number. Look, we don't even dance in the gray zone here. We want to be positive and upbeat and have good personal integrity and high ethics. That's all I recommend for all of you to do, is do the right thing as it's intended. Do not try to skirt the system. Keep your patients safe, keep your staff safe, and abide the rules. Go by the rules.
Yeah, okay, I think that's good advice.
Yeah.
We have a question from Joe. Can you receive both the PPP and EIDL loans? And we have heard that you can, but can't use funds for the same purpose. Is that correct?
That's exactly correct. Yep, nothing
Okay.
more to add to that. You can get both,
Perfect.
but you cannot log them in for the same purpose. And here's a little tip. For those of you who've gotten your PPP funds, here's a little tip for you. When the money comes in, put it in a separate checking account. Pay the PPP expenditures that are attributed to this program out of that checking account. Don't commingle those funds inside your business checking account. I would even go one step further, and I would set aside I would create a separate class inside QuickBooks, and I would call it PPP funds as a separate class. So now in QuickBooks, when you get audited or you have to prove how you use the money, you're able to show the separate bank account check register, check ledger on where the money went, and it's matching your QuickBooks on how the money was used.
Okay, good. We have a question. Does the PPP include payroll taxes?
I don't know. I want to answer that, but I really would like to pull that up. It is in the act. It's a little confusing on the payroll taxes, and I'm curious, is the question mean, does the PPP funding get based on the payroll taxes when applying for it, or are you referring to when you're paying during the 8 weeks? Does it include the payroll taxes?
This question is from Anne. Anne, I don't know your last name, so I don't know if I can ask you to be unmiked. Anne, if you want further clarification, please let us know your last name.
Her. Yeah.
Paying. She said paying.
Paying. Okay, so you want to definitely, my answer, and I'm not a banker or a lawyer or anything, but my understanding is that it's the gross payroll costs. It's the gross payroll expenditure. It's not the net to the employee, or you're not backing that out. I think it's the gross. So my answer is going to be your overall payroll run, whatever that total amount is. I believe that's a fully covered expense. If you want to follow up with us after this, I will research the act and highlight that exact section and share that with you. It is in there, and it does state it. I'm going off the top of my head, having gone through it so many times. I believe it is covered. And I will take this one last opportunity to reiterate, because I see this one question about New York City, and if I'm closed for 5 weeks, what do I? I'll say it again, if it's dangerous, you have a stay-at-home order, you're in New York City, you're in one of those, stay closed. Do not bring your employees back. Try to get them to take advantage of unemployment. That's what it's there for. Your doors are closed. That is not even a question. It has nothing to do with my answer earlier. Simply do what is in the best interest for your patients, your clinic, and your staff. You have a very easy solution there. Stay closed. Let them collect unemployment. They're entitled to it.
Yes. Okay. What do you suggest after June 30th when we possibly do not need all of our staff?
No, what are you guys suggesting? Oh, Kevin.
Oh, Kevin, you're muted.
Sorry about that. Yeah, I just wanted to say that, so on that aspect, we're hoping to, up in New Hampshire to hopefully see a turn on before that. We intend to bring everybody back. They all know that we're going to continue to work on building them up the best we can. But it's going to be a progression. It's been honest. We're trying to find the fairest way to bring people back on. And once they can get to the full point of a full schedule, we'll bring the next person on. We're still tossing around some different ideas because there's a lot of people who have patients that request them. And so if that's the case, we could bring them back, eventually going from maybe a part-time basis up to full-time. So we're still toying with some of those different ideas.
Okay.
My suggestion is that, at this point, we create opportunities that are beyond just seeing patients within the clinic four walls during this time, so that come June 30th, our income is not just based on those patient visits within the clinic. So creation on telehealth and virtual visits. As physical therapists, remember, we are movement specialists. We can do cash-based personal training, personal exercise progression. People that have, really been sedentary over this whole COVID epidemic. There's a lot of opportunity out there for us as physical therapists to do more than just see our patients within our four walls. So, I think we should all look at the opportunities that are out there for us and start creating on those so we can create on other areas to utilize our staff. So come June 30th, we're all able to continue progressing and have even more opportunity for them.
That's
Okay.
good.
That is very good. We have a question from Deborah. With the PPP funds, if owners usually draw more than $8,333 per month or $15,385 in 8 weeks, what is the best way to take draws in April, May, and June?
Well, that's an interesting question because draws are not part of, is this in relation to the PPP? Because draws, PPP. Okay. Yeah. It's salary, wages, commission, or other similar income. A draw correlates more to a 1099, like a sole proprietor kind of thing. And if you're taking draws, those don't count. So you're not going to get that forgiven. It's only your salary portion. Here at Meg, what we've often encouraged all of our owners to do, and this goes well before the pandemic, is to pay yourself a base salary between $60,000 and $100,000 a year and then take distribute, because most of our owners are working owners, right? They're working owners. So take a salary between $60,000 and $100,000 for the work that you're doing in the clinic as a clinician, and then take distributions or draws for your ownership piece. At the end of the year, you may clock in $200,000 a year, $150,000 a year, whatever that may be, between the two, adding the two together. And that's a fair exchange for you as an owner, wherever you are in the country, whatever scale that is. But it's a combination between salary and, of course, draws or distributions. Unfortunately, your draws and distributions are not going to be forgiven on how you pay yourself through these 8 weeks, if that actually answers the question, I do see another question. I keep going back to this one because I want to make sure I answer it thoroughly. If you are closed, let's say, because one of the people on our chat is from New York City, obviously. If you're closed and it's a stay-at-home order and you can't open up and you applied and received the PPP funds, you have two things you can do. You can open for business on a telehealth basis and let your employees do telehealth from home and try to service as many people as you can and pay those employees out of your PPP. When the 8 weeks runs out, that money will be completely forgiven, as well as any other of the associated expenses that are forgivable. And then the rest just give back if you don't need it. You don't have any prepayment penalty. Give it all back. or keep it to weather the storm moving forward. It's a 1% simple interest loan for a 2-year term, and you don't even have to make a payment for 6 months. That's a really hard place to be if you're in New York City and you are forced to be closed and you're only going to be able to use 1 out of maybe your 5 therapists, but at least you're doing some business. At least you're helping that employee. At least you're contributing positively to your community in that way. And then you can either give back the PPP funds, the loan that you don't need, or hang on to it as a loan and just pay. It is simple interest, 1%. And just, and you could pay it back whenever you want. There's no prepayment penalty. So 2 answers in 1 question.
Okay, good. And further clarification on the PPP, are expenses, for example, those paid for health insurance, able to be included only if paid during the 8 weeks or applied to the time period? If we had delayed having staff pay their portion of health insurance while they were furloughed, may we wait until after 8 weeks to have them pay back their share?
Oh boy, I don't know about the payback their share, but I do know that the payments on health insurance during the 8 weeks is a forgivable expense.
Okay, good. Does the PPP cover simple IRA?
Contributions, retirement contributions. I believe it does list that retirement contributions, even lists severance pay. Those are covered expenses. Again, it's in the act itself. Gosh, I'd have to pull it up to read the exact line. Again, if I'm hedging on that a little bit, because I do not want to give ill advice, by all means, reach out to us, go to our website, or just email in at info@megbusiness. I will do the research for you because I have it all there, and I will screenshot, I will cut and paste and send it right to you so you can feel comfortable with that.
Yeah, and so Ann wants clarification on, does the PPP cover simple IRA employee and employer contributions?
I will hunt that down for you, and
Okay.
just come to info@megbusiness, write it in an email so I have it,
Yeah.
and I will hunt that down.
Okay, good. What if people will not come back when you offer them back post receiving funds? How will this affect your eligibility for PPP forgiveness? So if your FTEs don't line up.
You can't get your employees to come back, or the patients?
Yes, you can't get your employees, I'm assuming.
That's a difficult spot. If you can't get your employees to come back, you can't meet the head count. You're not going to meet the forgivable side of things, right? But the reason why you got the funds is because you suffered a hardship. And even though you may not be able to get it forgiven in the 8 weeks, good chances that's going to be the cheapest money you're ever going to find out on the street. My advice is use those funds to fund your practice through the summer. I mean, that's my advice. I just think that it's a real important moment in time for you to really think a little bit longer term than just these 8 weeks. If you can't get it forgiven, you can't get it forgiven.
Okay, and Deborah asked, for full-time equivalent calculation, there appears to be a window after the end of the 8 weeks to get up to full staffing by June 30th, which is after the 8 weeks. How will this work?
So she's saying that she got her funds dispersed early enough that she completed her 8 weeks prior to June 30th?
Yes, sounds that way.
Okay, my understanding is the head count is calculated during the 8-week window of time that you have the funds to spend on your payroll cost and on your associated covered cost. That's my understanding of it. I have not seen that you can go outside your 8 weeks. I've not seen that.
Okay, and we have an option. Is the option of deferring Social Security taxes for 2020 exactly that, a deferment, or would this be forgiven as well?
Where's that option coming from? That's my question. I don't know.
No, it's from an unidentified owner, so I can't.
It's interesting. I need a little more information on that, where you're actually going to be able to defer your Social Security taxes. That's a first for me to hear that.
I'm just going to say, can you provide more
I'm sorry,
info?
Kevin and Angie. These are all like PPP
I know,
questions.
these are PPP questions.
We've
sorry.
got a lot of other good stuff to go over.
Okay, I do want to kind of get back into what you can have your staff doing now, because we've actually had some questions on this regarding marketing right now. Should you still be doing doctor drop-offs? Obviously, if you're not in a lockdown state, should you be doing anything like outside of just patient care? right now.
Yeah. I can speak to that a little bit. A lot of the
Sure.
doctor's offices around here are not open either. They're doing telehealth as well. So, even early on, they weren't the most receptive to people just popping in. I think that, given the circumstances, we try to make every communication about the patient. And we'll try to have all of our PTs have a reason to call the doc and let them know that we are here for urgent cases and we are doing telehealth. And just as a way to educate them that we're here as a resource to them to help their patients. We're focusing on that sort of messaging. In relation to, what else do we have in the staff do too? I think Angie's idea was great with the YouTube videos, but we're also
Yeah, I love that.
We're doing blog posts. We're doing, Facebook posts with, postural cues and tips. And the staff seems to be having a lot of fun with it. And we almost have a little competition going to see who can produce more of the content there. So that's the approach we're taking.
Good. Good. Angie, do you have anything to add on the marketing side of things?
My approach has been that if anything, that's where we should still be putting our time and our effort and dollars even, if we can, because again, this is only a period of time. This is going to turn around. This is going to be all over, and we are going to get back to hopefully a better normal than we were at before. I agree with Kevin. We've reached out to, any of our physician referrals and let them know we are offering telehealth sessions for any of their patients, letting them know that we are open as essential for their emergency acute patients. Aside from that, we do a lot of community outreach as well. So from a marketing standpoint, we've just been putting out as much content, as Kevin had said, as possible, just content with value, free content. We do a workout of the day. We do a fitness challenge of the day for our fitness community. We do a live Facebook and Instagram question and answer, and we typically get another medical professional on with us for some Q&A. Just as much community outreach as you can possibly do right now, and to continue to let your community know that we're still here for you. We're positive. We're moving through all this together. I think that's the most important thing we can do right now.
Yeah, I think that's great advice. I think that's very good. Okay,
I think I'm going to jump in and say something as the digital media guy here at Meg.
Yeah.
I think one thing I'm noticing, I've been very into streaming, and as you guys know, the Zoom chats here at Meg have just started during this whole pandemic. More and more people, families and your relatives and people in business are getting used to live streaming, and they're kind of being forced into it. And now it's like a daily thing. Everybody's in some type of live stream, whether with their friends at night or they're doing some type of meeting like this in Zoom. So definitely embrace live streaming. It's a great way to reach your patients, and it's so much more interactive than just a text post or just a regular video. So that was just my 2 cents.
I like it, Matthew. That's very good.
That's excellent.
Okay, I hate to shift topics back to the PPP, but we do have some questions we need to clean up, and I know we're running low on time here, so I do want to get to these questions. Anyone feel free to jump in. Kimberly is actually the one who asked about the option for the, the deferment. So she was saying that it was offered to her as an option when she went to run payroll yesterday.
To defer the Social Security?
Yes.
Like I said, that's a new one to me. I'd have to do some research on that. I'm not aware of deferment, but you know what? We're on this final version 3 of the CARES Act. So everyone's trying to interpret it, to the best of their ability. I'd have to do some research on that. I don't have a good answer.
Okay. So we'll get back to you, Kimberly. We also have another question.
Angie.
So, go ahead, Angie.
Just to add in, I would, if Kimberly has a CPA that she's working with, I would definitely recommend to talk to her CPA, because mine has advised me that we can defer the employer's portion of FICA right now up through December 31st. And that is without penalty. So I'm not sure if that's what in fact she's referring to from the deferment standpoint. But again, that came through my CPA. So
I think that's what she's referring to. I think you hit it right on the head, and your CPA should be very up on this because they have small business owners just like you. So Absolutely. We're not CPAs, but we are reading the same legislation. We are on all the same APTA websites. I mean, that's what I'm doing, trying to get my information from every source possible. But yeah, that does sound right.
We have another question alluding to the utilities question. And, you know, if your utilities won't be near that 25%, how far can you stretch to include things like EMR, web hosting? Like what can be included in those utilities?
Yeah, that's a tricky one. I don't think anyone's going to stick their neck out and define that because the government hasn't defined it. Every single line I read, it says utilities. So we do need a little clarification on that. I think that's going to go well beyond water, electric, internet. I do think it's going to encompass a bit more than that. Again, I think Angie's right. I think it's a good suggestion to consult your accountant and do what I did. Sign up for your state SBA webinars. I think every state's holding weekly webinars. That's what I did. I got on the webinars, and that's how I got a lot of the answers I received. Yep. I know Ann asked about her massage therapist who can't
I was going to get to that.
You know, can't get there for 2 weeks to see clients. She's sitting at home. She's making more on unemployment, which is completely appropriate. Your venue is closed for business for providing that service for obvious reasons. And it's the right thing and the safe thing to do, as we've been saying throughout this live Zoom chat. And she's on unemployment. You cannot just willingly pay her money out of the PPP for her to be home when you don't have a job for her. She has to be gainfully employed and receive payroll costs that fall under the forgiveness and fall under the PPP loan, you know, fall under the act in order for you to do that. So if in fact she's comfortable at home and you are closed and you don't have work for her, that is exactly where she should be is my advice on that. Unless you're going to bring her back and give her another job, you know, and you're going to employ her. That's totally fine too.
Okay. And Susan had a question. They're at a stay-at-home order in North Carolina, but they've had a few deaths in Charlotte and it's been decreasing. Feel that we can continue some in-person pediatric essential visits. Since it's been decreasing, we are considering more and more visits, essential in-person visits. Am I interpreting differently than you?
No, you know, if your state, every city is dealing with this in its own unique way. So I would seek local advice and guidance, given my city, given my state, am I an essential business? If I follow these policies and procedures in this environment set up, can I practice safely? Would you confer that I am doing everything within the guidelines that are acceptable for me to, you know, go ahead and treat people, right? If the answer is no, and it's not a safe environment, it is doesn't meet the guidelines, your doors should be closed because it's a stay-at-home order, maybe you're not considered essential in that state or not, you have to abide by that. You're going to have to practice within accordance to what your state and your local, you know, government is dictating. That's the advice. And that's been the advice throughout this whole web you know, live Zoom chat is for you guys to act in accordance with that. But if it's essential business, it's open for business, you have no risk in terms of, you know, no reason to have any, then just take it upon yourself to get the right data and operate appropriately.
Okay, another PPP question. For owners who have a base salary of 100,000, what is the maximum that may be taken during 8 weeks of PPP, and must it be taken weekly or monthly?
Well, if it's salaried and you have 26 pay periods, the pay periods you have in the 8 weeks are 4. That is going to have to be below, you know, the 100,000 or below, based on an annual spread, right? So whatever the 1/26th of a full 100,000 per year is per pay period, that's where you're going to have to be.
Okay, and John Scafidi, he listed, I don't know if this is just to help us. John, can we unmic John?
John knows a lot of stuff. He's been going to some of these webinars.
Well, I think he's providing useful information.
Yeah.
It's a lot to read. So what deposits and payments of employment taxes are employers entitled to defer? Were you just providing useful information, John?
I don't see him. I don't see his answer.
He's on. Are you there? Oh, you're muted. Can we unmute him?
I cannot unmute him.
Ah!
Yeah,
Uh-oh, John, can you unmute yourself or no?
he might not have audio abilities.
Okay, so we'll share, he provided section 2302 of the CARES Act. And there's just a big, long section here, so we can share that.
Good job, John.
Hang on, I'm going to copy and paste this to the group chat. Okay, all right. And just one, okay, that provides some clarification. So hopefully this will provide some clarification for you. I'm going to give this to everybody.
Hey, Kevin, let me ask you, in New Hampshire, if you look back at your average weekly visits in your clinics, what % are you actually down?
We're probably down 50%.
And what would you say, Angie?
Currently in this week that we're in now, we're down about 50% as well in clinic.
That includes telehealth. So a lot of those visits are telehealth.
Right. Telehealth, right.
Probably at least half of those.
So as you move forward, you're looking to inch up from 50 to 60, 60 to 70, and just kind of ramp that up, correct? Right. As you do that, how much is your CEO attention split between building up your telehealth program for the long haul as opposed to continuing your bricks and mortar and bringing patients in like usual?
Do you want to go first, Angie?
No, go ahead, Kevin.
Okay. I say we're putting a good amount of attention on telehealth. I don't think it's going away. I'm hoping that, a lot of these restrictions and barriers that were lifted stick around because a lot of people are finding it helpful and more convenient. I'm really hoping that we have the option with people moving forward. And I think that, we're working with, the vendors that provide us the service to create a good long-term solution. I don't know what percentage it's going to be in the long run, but I certainly see it playing a big role. So we're certainly not taking our foot off the gas pedal on that aspect.
Excellent. What about you, Angie?
Yeah, I would agree with you completely, Kevin. Right now, and because we are still at about that 50% just in office down, we're actually focusing more of our attention right now on the telehealth side of things. Because that's where we're going to be able to serve our community the best. And we want to continue to really focus on that until we have the clearance, hopefully at the end of this month, that the stay-at-home order is lifted, and we find that it's a much safer environment for our at-risk patients or at-risk community members to get out. And then at that point, I feel like it'll be pretty divided, because I agree with you, Kevin. Telehealth is not something that we want to see go away. And we definitely think it is beneficial. I don't think obviously it doesn't take the place of physical therapy for some of those acute manually based conditions that we still need to be treating. But I do believe that there is a good, it can definitely service our community in a really good light. So.
Yeah, if you one more thing, I just like to add that I think it's a great opportunity for us too to keep pushing for direct access, because we can keep the volume of people going into doctor's offices down. I'm really hoping that we can continue to capitalize on being the first point of contact for some of these patients with musculoskeletal conditions.
Absolutely.
Yeah, I think that's
could
a
not
good
agree
point.
more. That's a very good point. And I love to hear you guys saying what I'm hearing from across the country is don't set up telehealth on, FaceTime. Don't go fly by night. Even though there's waivers given to the HIPAA compliance side of it right now, I highly recommend you reach out to, Daniel Seidler at, TelePT Solutions or some comparable. Get the right policies in place, get the right HIPAA platform in place, get the right procedures to be followed and trained with your staff, because we all know that at this moment in time that you have funding, investing in your staff and getting their skills and their training up, whether it be in telehealth or whether it be in your new restructured practice model, you absolutely want to work on that. You absolutely want to take this moment in time and invest in that for the long haul. I truly believe that the future is going to be a balanced approach between cash-based services, telehealth-based services, and insurance-based services. This is going to be the new mantra. This is going to be the new paradigm. And it's only a matter of time. I hope on my crystal ball every day that Medicare is going to include physical therapists as a service provider for telehealth. They've already approved the services.
Yeah.
They just have to list us as a provider. So I encourage all of us to invest in our staff, invest in ourselves, and train during these next 8 weeks so you come out a stronger company. So
Yeah. And
glad to hear you guys say that.
Yeah. And Dan made a good point. You know, we can still offer telehealth services to Medicare patients just as a cash-based service.
Sign
So
the ABN.
that
Yep.
is, yep, sign the ABN, and you
Yep.
know, that is an option for people, especially during this time. To keep moving becomes very important. So,
Fantastic.
okay, well, I just want to wrap everything up. I want to thank you again, Angie, for joining us, and Kevin, thank you for joining us and for your insight. I think that's been very valuable, and hopefully, you know, people have taken a lot away from that. I think there's some great ideas there. So thank you. We will continue on next week with this being a leader in this during the pandemic topic. So please join us next week at the same time. And again, if you would like a sneak peek into Meg Academy, we are going to, maybe next week, we'll show you a look inside Meg Academy of what it's all about. But we are offering the sneak peek for you to fill out a form and get in there and see it for yourself. We're happy to hear your feedback on what you see too. So thank you again, everybody, for listening, and we appreciate all the questions. Keep them coming.
Thank you, everybody. Thanks for this community. This is wonderful.
Yes.
And thank you, Angie, and thank you, Kevin, for participating. It's beautiful.
Thanks
Thank
for
you,
having me.
everybody. And
Thanks
just
for
to let
having us.
everybody know too, the link is in chat right now. On those 2 pages you saw, the first one is the page where you fill out your form, and then you'll get to the second page. I'll also put the link in tomorrow's replay email. So you'll see the replay link, and right below that will be a button you can click on to access this exclusive page as well. So any questions, just email info@megbusiness.com, and we'll get that link right out to you. So thank you, guys.
Perfect.
All right, thanks all.
Thank you, guys.
Bye, guys.
Bye, Angie. Bye, Kevin.
Bye, Brian.